Introducing the newly developed ALS system for dental implant prosthesis. This is a photograph of both implant prostheses made with the ALS system. This is a picture of a dental implant prosthesis. This is a picture of the occlusal view and advanced lateral screw. It is a prosthesis that looks like a conventional lateral screw system, but cannot be made in all ceramic restorations. I will explain why this is a new system later. This slide describes how to achieve the retention of a prosthesis used in dental implant prosthetics. You can see the existing screw type, cement type, and newly developed ALS type. The existing screw type has a screw access hole on the occlusal surface but no ALS type. In addition, the abutment style is the same as the cement type, and the abutment screw has an abutment screw with a post-type shape. I will explain in detail later. This slide is a radiograph of a patient who came to our hospital. Looking at this photo, you can see how accurate and well-maintained implants and prostheses are. This is a picture of the oral cavity of the patient. The prosthesis was cemented with permanent cement. By the way, the problem is that the patient complains of a bad smell and pain. What treatment should the dentist choose? Let's look at the complication that occurs in the treatment of dental implants. According to the report, 37.4% of complications occur in dental implant cases, of which 28.9% are reported in implant prostheses. The disadvantage of dental implant screw-type prosthetics is a hole formed in the occlusal surface. There is a psychological or functional problem. The system that improved this is the ALS system. The ALS system will give satisfaction to patients and dentists. Can all anterior implant prostheses be screw type? Is it possible to make holes in the occlusal surface of the screw type implant prosthesis? Can all ceramic implant prosthesis be made into an aesthetic screw type? The solution is to use ALS implant prosthesis. In the later screw implant prosthesis system, compare the style used in the past with a currently developed style. In the past, the screw housing was located in the abutment, and the development product was located in the prosthesis. In addition, the holding force was obtained by the squeezing force in the past, and the development product obtained by pushing force in the undercut. The key point of the ALS implant prosthesis system is the position of the lateral screw housing within the implant prosthesis. The ALS implant prosthesis uses a cement-type abutment, so the resistance function of the implant prosthesis is superior to that of the existing screw-type implant prosthesis. There are two methods for ALS implant prosthesis to achieve retention. First, when the abutment thickness is thin, through the abutment. Retention is obtained from the undercut side of the abutment screw of the post head type special screw. Second, when the abutment thickness is thick. The undercut is formed on the side of the abutment to obtain retention. Second, when the abutment thickness is thick, undercut is formed on the side of the abutment to obtain retention. This picture is the process of setting the ALS implant prosthesis. First, connect the traverse screw to the prosthesis. First, check whether the prosthesis fits in the oral cavity. Then apply the silicone sealer to the margin, insert it, and then use the driver tool to screw. Tighten. The reason to apply a sealer to margin is to prevent malodor. This picture is the device used to tighten the T-screw. The power used is 15 Newton. The T-screw can be operated in any direction, and the ALS implant prosthesis can set the T-screw position to the desired position by the dentist. The existing lateral screw type is in a position determined by the manufacturer, so the position cannot be changed. This is the maintenance slogan of the ALS implant system: wipe, tighten, and care. The space in the oral cavity where the ALS implant system can be used is as follows. The inner maxillary space is at least 4.5 millimeters. And the thickness of the prosthesis to be inserted into the screw housing is at least 1.8 millimeters. The advantages of the ALS implant system are 100% retrieve, no using cement, more aesthetic and function. It is an existing lateral screw type fixture, but it is inconvenient because the cingulum side is too thick. However, the next slide can change the position of the lateral screw in the ALS system. The ALS implant system can be changed to the proper position of the housing when the cingulum side is thin. The rest of the information will be explained next.